Imagine a world where a disease once declared eliminated is now making a fierce comeback. Not because we lack the tools to fight it, but because many people are choosing not to use them. This is the reality with measles today. Once eradicated in countries like the United States, measles has returned, with outbreaks spreading rapidly in cities and communities that were previously protected. The key culprit? Vaccine hesitancy, driven by misinformation. Measles is one of the most contagious diseases known to humankind. One infected person can spread it to up to 90% of unvaccinated individuals nearby. Yet despite the overwhelming scientific consensus confirming the safety and effectiveness of the measles, mumps, and rubella MMR vaccine, vaccination rates have dipped below the threshold needed for herd immunity in many places. Why? Social media platforms, influential figures, and poorly regulated online content have given rise to a flood of misinformation. False claims linking vaccines to autism, infertility, and other health problems have taken root, especially among parents seeking to make informed choices for their children. The infamous and thoroughly debunked 1998 study by Andrew Wakefield, which falsely linked the MMR vaccine to autism, continues to resurface online, keeping alive a dangerous myth that has been disproven countless times. Ironically, the success of vaccines has led to their own undoing. Because measles became so rare, new generations haven't witnessed its devastating impact, making the risk feel distant or even non-existent. In 2024 alone, the World Health Organization, WHO, reported a shocking 30-fold increase in measles cases across Europe compared to the previous year. This isn't just a local problem, it's global. International travel allows the virus to spread rapidly from region to region. And wherever there are pockets of unvaccinated people, outbreaks follow. Countries like the US, UK, and Australia have seen growing resistance to childhood vaccinations, often influenced by online communities and alternative wellness movements that emphasize natural immunity over proven science. What's even more alarming is that some of these groups deliberately target vulnerable communities, spreading doubt and fear through emotional anecdotes rather than evidence. Public health officials are now racing to counter these narratives with education and outreach, but it's a battle against an ever-expanding tide of misinformation. The Centers for Disease Control and Prevention, CDC, warns that if current trends continue, more frequent and larger outbreaks could become the norm rather than the exception, and the consequences go beyond measles itself. When confidence in one vaccine drops, it often spreads to others, leading to lower vaccination rates for diseases like polio and whooping cough, and putting even more lives at risk. The solution is clear but not easy. Combat misinformation with clear, accessible, and empathetic communication. It's not just about stating facts. It's about rebuilding trust. Doctors, scientists, and community leaders must work together to reach people where they are, online, in schools, and in local neighborhoods, to ensure that everyone has the knowledge they need to make informed health decisions. Because in the end, the return of measles isn't a medical failure, it's a social one. And unless we address the root causes of vaccine hesitancy, outbreaks will continue to rise, putting millions at risk of a disease we once had under control.